Hello from Uzbekistan, the heart of the Silk Road. October is Breast Cancer Awareness Month, and with us here today, Dr. Maksud Mallaev. And welcome. Thank you for coming today. Could you please introduce yourself?
Thank you. I'm Dr. Oncologist Maksud Mallaev. Here about more than 20 years we are working on that field, and I'm a medical oncologist, so we are treating not only the bodies or the parts of the body, we are treating whole the body. So I'm doing chemotherapy in Uzbekistan here, all types of the chemotherapy, and any difficulties we are doing here.
Okay, well, for the first question, could you please tell us what is breast cancer? Like, what kind of a disease it is?
Breast cancer, it's the most common cancer in women. Each 8 women may be the breast. I mean, the 1 to 8 women can suffer with breast cancer.
So 1 in 8.
1 in 8, and 1 in 10,000 in men. It's very rare in men. Breast cancer, it's the disease. It's the like a, how can I say, uncontrolled group of uncontrolled cells in the breast. Breast is the fat tissue.
Yeah.
So till the 40 years, it's getting growth. I mean, the getting growth, it works. After the 40 years, it's just getting decreased. I mean, the getting change its structure to fatty tissue. That's why during this period, it's a little risky period for all the women.
Okay, so can you tell us more about the symptoms and what should everyone look out for? Like, what are the most common problems? And
symptoms in breast cancer or any disease of the breast, we can just count like symptoms, but not all the symptoms may be at the same time. First symptoms is like a bulky on the breast, or there is a feeling of something inside the breast. As you know, breast is like a smooth and a little you can just touch it by all the parts. It's the outside part of the body. That's why you can by your hands, just with your hands. It's a self-examination. We call it like a self-examination. Just with your hands you can touch and take more than 90% of information just with your hand. It's because it's the outside of the body. So bulky on the breast, in the breast, it's the first symptoms. Another thing, the changing of the skin on the breast, like a locally changes. Maybe they're getting the reddish, maybe they are a little we call like a lemon skin. It's like a there's a getting bigger of the pores of the skin, and then another symptom is like a this discharge from the nipple. It's sometimes there will be a little like a milk, or maybe a little smelly discharges from the nipple.
And you also said that it happens in 1 in 1,000 of men, right?
Yeah.
So it's a problem not only for women, but also men can get affected by this disease.
In men it's a very rare disease, but we will see like these patients also. It's very rare. In a year, maybe 1 or 2 patients may come in the male groups. And treatment and everything, it's the same with the woman and the man. But it's rare in the man. That's why I don't know what to say.
So in Uzbekistan, it's usually in a year 1 or 2 people come to you with this problem, right?
Yeah. We are a rare one. That's why.
And how many women usually, like, can you count?
In a day or in a year? It's very difficult in a year to count.
So it's a huge number in a year, right?
Huge number, and the you know, the oncology patients is like it's a systemic disease. Like they are coming systematically, and every 3 months, every 6 months, or in a year once they are coming regularly. This is why if only count by new patients, in a day minimum 2 or 3 patients come with a new breast cancer, new detected breast cancer.
I see. And so how many stages does this disease have?
As other organs, I mean that as all the oncological disease, in breast cancer also the 4 stages.
4 stages.
But the difference with other organ disease, I mean the other oncological disease, the breast cancer also divide to hormone positive, HER2 positive, and like that parts. It's a molecular parts. That's why it's a little difficult to understand. It's only for doctors to. It's showing us the way how to treat, how to manage, how to care. Everything they are showing by molecularly. This is why I will tell you like simply 4 stages in breast cancer. But first, the last stage. I mean the first one. The last stage also survive, also live minimum 10 years. It's a best learned, best studied disease among the all oncological disease. It's the best studied one, the breast cancer.
That's why the chances of survival are higher. Even on the last stage.
Sure.
Do we have all the necessary equipment and enough specialists in Uzbekistan to effectively cure this disease?
It is a little like a question. It's specialists and the equipments is not always there coming together. Sometimes some places have all the equipments, but is no specialists, and some place there are a lot of specialists, enough specialists, but not enough of equipments. So by the regions, and the Uzbekistan's not only in Tashkent, they have 12 regions, and by the part of the regions also, inside the part of the regions also, there are not enough specialists. Even in Tashkent also, there are only. But you can count by your fingers, not enough. Only that you can count by your fingers the specialists, even in Tashkent also. So we have an oncology center. It's the Republican one. It's the National Oncology Center, or sometimes we call it Republican Oncology Center, and the City Oncology Center. There is a in Republican Oncology Center. There is a big department who is only preparing the specialists and preparing the specialists, and they are having the exchange the experience also with the regions. They are calling regularly and showing the new things, new equipments and new techniques, everything they are showing, and just making like a master class there. In Tashkent City Oncology Center. It's also in the Tashkent, and it is responsible, this oncology center responsible for people or population of the Tashkent city. They are doing regularly the checkups for women also. It's mammological checkups and the gynecological checkups. They are doing regularly. They are doing, and our government also giving a lot of supply, a lot of enough
Budget.
how can I say
Budget.
to do that. And actually I wanted to tell that that's something the last year or before last year we bought in Uzbekistan the oncology center. The government gave to oncology centers the big car van, I can say. It's a van inside there, the mammography and everything for check up all the regions, even the farther ones. They are going, and it's the well equipped the van inside there, the laboratory, mammography, ultrasound, and the X-ray machines, everything inside the one van, and they are going regularly by the regions, by the parts of the farther parts of Uzbekistan, and they are doing the checkups to detect early breast cancer, early all the oncological disease. Because if they detect early, if you find the one patient in the first stage, it's the how can I say, it's just keeping government's budget about the $40,000-$50,000. If I mean that, I can explain a little simply. If you just find one woman, one patient in the early stage, the budget for this patient, it's very small to treat. It's a $10 maybe. It's a $10 you can spend for her to treat fully on the first stage. If you just come to, or you, how can I say, it's if you find that first stage, the last stage, the advanced stage, so you spend more than $50, but you cannot treat it, just prolong the survival. That's why it's the program, there's a program, oncological program, that every 6 months they are regularly checking the population and detecting the high risk groups. High risk groups detects by the mother side or father side, the genetically information, and there is a groups of people who is working on the a high risk places. It's also some maybe the risk groups, maybe we can say that, and that's all.
It's like you gave a lot of information. Also, well, you were talking about the vans supplied by the government, right? Has there been any substantial developments in the recent years? So you mentioned vans, maybe there was something more that has just ramped up the evolution, the treatment of oncological diseases in Uzbekistan.
Here in Uzbekistan, doctors, they are regularly keeping change or exchange that information from abroad, from all the oncological centers in the world. Actually, I studied in Israel, Italy, Switzerland, and I've been almost all of the world where is the treating the cancer. And all the big hospitals, small ones, even that's placed like a, how can I say, place they are doing not medically but by the natural some things like that. Even I interested on this place also.
Herbal treatments, kind of.
Yeah, and look, treating the cancer is very difficult, but you can control it without any problem. Who wants to treat the oncological patients, no oncology cancer, it's unbelievable. It's not truth. But who says you control the cancer, it's the believable one. Our responsibilities, oncology, we are doctors, oncologists, so our responsibilities is to control the cancer, not to treat.
So it is impossible to treat it fully, but it is more possible to keep it from developing further.
Yeah, it's like a sugar disease. If you
Diabetes.
do everything on time, the patient live more than 10 years, 20 years, 30 years, how much God gave. If you don't do the high requirements of doctors, if you are not doing taking the medicines on time, it gives the less and less effect then. So we can only control the cancer, and our job also is same thing, not to treat.
So it is like diabetes, right?
Like
you
a diabetes.
need to control your diet, your medicine, and it's gonna be fine.
And you don't, you shouldn't afraid of your disease. It's a problem.
Yes.
Disease, it's a problem. If you afraid of your problem, not going face to face with your problem, just afraid of your problem, the problem is getting worse and worse.
Yes.
If you go face to face any of your problem, it's also disease, also same thing. Go to your problem, or how can I say, it's against the problem. It is, the problem is getting less and less. I mean,
so we shouldn't run away from our problems. We need to face them, right?
Yeah.
Okay, and also, do you have any statistical data? Well, you said that, for example, you might receive 1 or 2 female patients with breast cancer. What are the ages usually? So you said it's more common after 40 years, right? So most of the patients should be over 40 years? Or are there younger people too?
40 years for women and for men also, like years of the, how can I say, dividing, or like
can you sort out by years which people of which age come most to you with breast cancer?
The cancer is getting younger and younger year by year. Actually, in 5 years before, I can say that I only in a 1 year I see like a young patient between 20 to 30, only in a year 1 or 2, maximum 3 ones. Now in a month, more than 3-4 patients coming between the age of 20 to 30. It's getting younger and younger, and statistically also the same thing in the world, not only in Uzbekistan, in the world also same, getting younger. But the risky period is started from 40, because our organism, or our, how can I say, hormonal status is changing, started changing in from the 40 years. That's why we just recommend all the women, everybody, all the women after the 40 years doing doing the every 6 years,
6 months,
doing every 6 months the checkup, or just every month we recommend them to self-examination. Once self-examination is a very easy. You can find on the YouTube also.
Yes.
There are
on
a
our
lot
YouTube.
there are a lot of types you can find there, and you can just in front of the mirror you can check yourself, whole the body,
Yes.
skin. It's our is like a sunny country. That's why to skin to change to check your skin, it's here in Uzbekistan is sunny place, so you can check by the in front of the mirror your skin, hold your skin to see your black dots. I mean it's the melanoma. We have like a cancer of the skin about melanoma to protect your skin, your body to being the melanoma. I mean, I'm just giving the information simply. That's why it's if somebody sees, somebody watch the doctors can see this video, and maybe it's very simple for them, but for population is very simple. That protect or to detect the melanoma. And another thing, self-examination in front of the mirror. We recommend all the women who is after the 40 years. And each 6 months we recommend them to do the ultrasound of the breast, and if there is on the ultrasound there is anything suspicious, we send them to mammography. Till the 40 years we are not recommending any woman to go to have a mammography, because the mammography also the high dose of the X-ray and can be cause of the cancer also. It's a high dose.
So lastly, about the rate of curability, has the number of casualties, fatalities decreased in the last years in Uzbekistan?
It's a very difficult question, but I will try to answer it. In oncology, we have a survival time. I mean a progression-free survival, overall survival. We are just assessing our patients by survivability.
Yes.
I mean, before 5 years, maybe 10 years, the survival rate, I mean, it depends on the stages also. Before I said that, in the first stage, it depends on the molecular types also. It's not very simple to explain everything. It's maybe the hormone positive ones. 10 years they live about the 5 years. It's a 5 years survivability we give them by the percentage, like 5 years survivability maybe about the 70 to 75%. Now 5 years survivability in hormone positive first stage patients, more than 15 years. More than 15 years. I mean the 100% of 5 years survivability. It's getting increased, getting improved all the treatment methods. Hormone blockers. They are not before 10 years there may be only 1 or 2 hormone blockers. Now we have even the injected ones. We have like new things, and now we are by molecular type. We are preparing special drugs also for them. I mean target drugs, not only for the HER2 positive ones. Even by the next generation sequencing, by the checking the genetic types of the cancer, we are giving them specially the drugs. It's like a personalized medicine. It's very like a small parts of the oncology, like a very molecular types, molecular parts there. We can say that.
So, well, the curability rate and the treatment has enhanced a lot in the recent years, right? Well, thank you for coming then and for all this information. It has been very useful for me and for our audience too, I hope.
Thank you.
Yeah, thank you for your time.
I want to say to our nation, to our population here, don't afraid any oncological disease, even the breast cancer also. in Uzbekistan, I can say like that. Uzbekistan's oncologists can conquer whole the world's oncology doctors, and we are same, and some places maybe the higher than other oncology doctors. So any problem, anything, just come and don't be shy and don't be afraid. Thank you.
Yes, thank you.